Welcome back. I have on set again with me today Pastor Dr. Olushola Okola. He is a consultant pediatric neurologist. Welcome on set again, sir.
Thank you, Pastor Tony.
All
Good
right.
to be here.
In the last episode, we were discussing cord management,
cord
cord
management.
care. So I'd like you to just take it up from there.
Yes, the cord is vital because once it is cut, there is access to the external world and the internal content of the child. So immediately it is cut,
Yes.
the vessels inside shrink, but they don't close 100% immediately. And then we expect the cord to dry, shrivel, and fall off. But it now depends on how do we manage it. What did we do to it? And then I was saying that it starts from what was used to cut it, what was used to tie it. It has to be things that are clean and sterile. These are the little places infections come in. And we were looking at tetanus as one of the infections, but other infections can come in. And remember, it's straight into the abdominal cavity, straight to the liver, where the intestine is, the blood, and then the infection roars all over the baby. And then a major illness has started. So after the cord has been properly cut with a clean surgical blade and tied with proper sutures or thread that are neat, then the cord care is leave it exposed, clean the base upward with cotton wool and methylated spirit, proper methylated spirit. You don't need to put hot stone, leaves, use hot water to baptize it.
Hot knife.
Hot knife, no. So
Mentholatum.
Mentholatum is introduction for trouble because menthol can be absorbed by the skin of the unborn baby. And menthol can lyse blood cells and it will cause increased propensity for jaundice, neonatal jaundice.
So those that want to use mentholatum to rub the baby.
Those who use rub mentholatum both on the head and on the navel, they are asking for jaundice. And if it occurs, it can be dangerous. And so what it needs is keep it clean and dry with methylated spirit. Don't allow it to be inside the pampers where urine and feces will be.
So it's dry.
Within a week, most cord will have fallen off. And they will be dry, they will not be smelling. At least 4 to 6 times a day, cleaning the base properly and upward. And the next, so don't hold the cord and clean downwards.
Okay.
No, from the base upward.
So
that all the dirt is removed, the debris are removed by
Yes.
and the person should be generous with the methylated spirit so that it does its work. That is very important because when neonatal tetanus occurs through the cord, it's severe tetanus. The child will surely be left with complications, and most of the complications will be in the brain. Again, short-circuiting the potential of the baby. And when a newborn baby is ill, no self-medication. Because in some hospitals, even a normal newborn, especially healthcare centers and some places, they give the mother a list of drugs to have. Multivitamins, paracetamol, some gripe water, all sorts of things. And they tell the woman, every day administer. You can't administer paracetamol every day to a child. And babies don't need gripe water. So I've had the opportunity to see a baby who had paracetamol toxicity and actually bled to death because the liver was damaged and the liver produces clotting factors.
Yeah.
So no drug except prescribed by a doctor. The advantage of getting prescription from a properly trained medical personnel cannot be overemphasized because you can give what the child does not need. Then when we look at preparing again, for example, if it was an infant of a diabetic mother, a mother who is diabetic during pregnancy, that's a special pregnancy. It must only be managed by an expert.
Yes.
The baby can be too big, can be too small. Then, if the diabetes is not properly managed, congenital malformations of the heart, of the brain, of the eye, mouth, ears, we see them because of the uncontrolled blood sugar. Then that woman cannot deliver just anywhere because that baby's blood sugar must be checked immediately after delivery. Hypoglycemia can kill. And if it does not kill, it will damage the brain. The brain is an obligatory glucose user.
Yes.
It needs glucose to run. I've had the opportunity to attend to a baby that way. And immediately the baby came out. And we were cleaning, suctioning, crying. As we were trying to put up a line to take that, set up a line for glucose infusion, and then we are doing heel prick. The baby went blue. Glucose has finished. Baby stopped breathing. But thank God that that woman delivered where somebody who knows. This was within 2 minutes. Baby was already going blue. Respiration was shallow. I cannot imagine if somebody wants to rush that baby to the hospital. Which hospital are you rushing the baby to?
Take the baby to?
Under 2-3 minutes. It can be that fast in some babies. That means as they came out, within a minute or two, glucose has gone below normal.
Again, re-emphasizing how important it is for a pregnant mother to ensure that at least they are seen in antenatal clinic by a doctor.
Yeah.
At least twice, 3 times within the lifespan of that pregnancy. So they can be assessed.
These things must be planned. In the teaching hospital, these things are planned. But we are aware that people who deliver in the teaching hospital, they are not up to 20% or 30% of the deliveries. And those who deliver in the hospital, I'm not even sure. On any form of hospital, I'm not sure they're up to 60%. Depending on the area, depending on the city. We're in a city now. But there are places far from the city. And this kind of thing leads to early neonatal deaths. They will say, we don't know what killed the child. The child may have died of low blood sugar.
Yes.
Then the child that didn't die, the brain now is impaired. Intellectual disability is almost always following hypoglycemic crisis in a neonate if something is not done to prevent it.
So when we say hypoglycemic,
That
we're
means
talking about low blood sugar.
Too low.
Okay?
Too low. And by planning, it can be prevented. And that's what also you see when the hospitals have what we call a breastfeeding policy. We want every newborn of a normal delivery, where all these complications are not there, to be able to latch onto the breast within 30 minutes of being born. If a newborn cannot suckle at the breast within 30 minutes, maximum 1 hour of being born, that newborn baby was stressed because suck is a reflex. The baby suckle not because they are hungry. We put something in the mouth, the reflex is triggered. And when they are hungry, they will suck at anything that is available. So if a mother delivers a baby, and after delivery, the baby slept for 6 hours, that means your baby went through a bad journey. Because the next action was not to sleep. The next action was to feed. Because the baby has been disconnected from a continuous source of food, and hunger will set in within 30 minutes or so. So I'm asking someone, I say, okay, when you delivered, okay, what happened? The baby cried. Oh, baby cried. Then what happened after that? He slept off. He slept off. For how long? For almost 6 hours, 12 hours. They even have to tell me to wake the baby. I said, that means the baby didn't come out well. A healthy baby is ready to eat within 30 minutes. So if your baby was not ready to eat within 30 minutes, you need to see a pediatrician. The baby may need some help. 30 minutes, 1 hour, a newborn should have fed.
So that's an indicator.
Yes, an indicator of how the labor went.
Okay.
Even if it is a few mils of colostrum, the baby has suckled something. it shows that everything is okay because the job of the baby is sleep, wake, eat. So if not being able to suckle, that means you put the breast, the baby is either licking the nipple, he's not able to grab and pull. That strength is not there. That baby went through a stress. Or that baby is born with a problem. And all these things are signs we look for. Now, it now depends on what severity the stress was to now determine the long-term complications. But immediate things that should make a mother be concerned, or a baby is born and the baby is doing, there's nothing in the mouth. Lip smacking. That's a seizure. That baby is having a seizure. Something is sparking in the brain. It's an indicator that something went wrong with that baby. Too much stress during delivery. These little things help to guide. But you see, if you are not in the right place, nobody can raise the necessary flag for you to know that let's check on this baby.
Wow. It's been so enlightening. We need to go on the break now. Stay with us. When we return, we will continue with Pastor Dr. Olushola Okwonla. Welcome back. We've been discussing preventing infant post-delivery morbidity, and I still have on set with me esteemed Pastor Dr. Olushola Okwonla. Yeah, so we're talking about cord management, and then we have progressed.
Yes, we progressed to the after delivery, the baby should be able to eat well.
Yes.
Ability to suckle is vital for life.
Yes.
A child that cannot feed, that child's life is in danger. And so these are things we look out for.
Yes.
And that's why if you're in the right place, something can be done. For example, a baby is born and the baby is crying and the crying cannot be stopped. The baby is screaming away. 10, 15, 20, 30 minutes. Something's going on in the brain.
So that child needs to be brought to see
the
because
so these are the injuries that occur based on what goes on in the labor process. And then what are the things people do after a child is born that can put the child in trouble? Let's say everything went right.
Pastor, you were talking about mouth smacking earlier.
Yeah, lip smacking.
Yeah, lip smacking.
That's a seizure. A child is just smacking the lips. It's a seizure. It's a sign that the baby was stressed.
So seizures could occur in infants as a result of this. You know, you talked about compression of the brain because of the
shortage of oxygen, because of prolonged labor.
Yes.
Various things. It could happen.
So they start having seizures.
They start having seizures. And you must recognize so that we stop it quickly. If not, we'll be meeting that child after a few years. The seizures have been going on since delivery, since the child was born. Different patterns that the mom may not really understand. Okay, so that's why I'm mentioning, especially the one of the crying, abnormal crying. For example, there are people who have children who hardly can sleep at night. If from around the age of 1, 2 months, around 12, 1, the child starts crying. Until 4, 5, nobody is resting. You feed, you dance, you bathe, you change it. That the child is telling you, I'm not fine in my brain. Get help from me. Because a newborn baby wants to eat and sleep. An infant wants to eat and sleep.
So it's not just that the child likes to cry.
No, there's no child that just likes to cry and likes to disturb.
This one is a very
quiet
child.
If the baby is not wet, the pampers is not soiled, the baby is not hungry, the room is not hot, the baby wants to be carried. If all those things have been done, 1 hour, 2 hours, a baby is not calming down, the brain is being disturbed. And it could be from meningitis. It could be just seizures from the brain injury. Something could be going on. And these things, when they are not quickly addressed at that time, they result in lifelong disabilities because those seizures can be stopped. For example, a mother who went to deliver somewhere and she was draining liquor for 2-3 days before she delivered. Immediately that sac burst, the baby is exposed to the outside world. Infection can ascend. And the delivery can be perfect. But a few days later, the infection manifests. Difficulty in breathing, convulsions, it can go to the brain, it will enter the blood. These are things that should not happen. A woman's sac of liquor should not break and baby is not out in less than 18 hours or 12 hours, depending on which stage of pregnancy. Is it the first pregnancy or second? So by the time a woman is draining water 3-4 days, it's invitation to infections. It will ascend. And when it ascends, it's the baby. And the baby is born without prior sensitization to any infection. The mother has been the defense. When the baby comes out, the baby must defend himself or herself. So breast milk supplies some part of the defense. Then the way the child was born will be helpful. If the child has inhaled purulent liquor, infections, that child must be helped because the infections can go to the lung, they can go to the brain or other organs in the body. And if they are not well treated, permanent disability. Yes, the baby may not die, but the child is disabled in one way or the other from one problem or the other that happened. So this, having a planned and proper delivery it should be the norm. It should not be something that somebody hopes to have. Right now, sometimes like people are hoping to have it. And those who are handling deliveries need to be trained and retrained every year.
And this really is the standard.
That's the standard.
The normal delivery is planned. The expectation is worked towards and you meet that expectation. That should be the norm.
That's the norm.
Any other thing should be the rare exception.
Yes, and people should stop opening places for people to deliver if they are not ready to put resuscitative equipment, employ proper doctors and proper nurses, proper, well-trained people who must also be retrained, because the society we are in does not support the disabled as a norm. Then when you now talk of the mentally challenged, intellectually disabled, there's virtually nothing on ground for them. And in the process, the burden is entirely on the family. And when the family can no longer cope, they have thrown the child into the street. There are some people who are roaming about the street naked today that are not schizophrenic. Their brain was damaged by all these processes.
And
it was as they were neglected that these things now
is actually
evolve,
preventable.
and these things can be prevented. The key word here is it can be prevented. The doctor should prevent, the nurse should prevent. Know your limits, know your training.
And this is why this program is so important, because now parents can, find themselves in a position to know what is expected, know what they themselves need to put in place, questions that they can ask. There's absolutely nothing wrong in a patient asking these questions of the health institution where they want to deliver. Do you have this?
Here? What's the qualification of the person?
Doctor? Yeah, there's nothing wrong. Absolutely.
You are there to seek health care and you're going to pay for it.
You are paying for it. You're paying for it.
So somebody should not tell you, I'm an expert in this and the person is not.
Do they have equipment for resuscitation? Do they have?
Yes.
Do you have
do they even have oxygen?
Do you have backup power supply?
Ask those basic things. Because the newborn baby, everything about them is timed in hours and minutes. That means the response has to be in minutes, hours, not in days. So for the first 72 hours, we date the child as per hours. So this is a 45-hour-old baby. Because we are monitoring something. And this is important. When a child is delivered in a proper place, if the child was born with disabilities or some challenges that are not really life-threatening, in the wrong place, they can become life-threatening. But in the right place, the right thing can be done. If there are inborn errors of metabolism and the child is having severe salt-losing disease of Addison disease and whatever, It's somebody that will pick it. If the child has a cleft lip, cleft palate, they can help the child in the proper place and plan a repair later. If the child has a heart problem that can be amenable to surgery, if it's close to the right place, those things will not lead to the demise of the child. Because these are morbidity. There are some morbidities that occur because of where the child was born and the environment and the capacity that is there. They are different from morbidities as well with lack of money and then lack of expertise, which are also different from morbidities associated with the person who is now managing the person. Does the person know what to do? Or the person who they took the child to added to the problem? Yes, you see people say they were referred to one hospital. The quack referred the person to another quack because that quack thought that this quack was genuine, who now eventually, by the time they were getting to the fourth one, they got to the genuine person. And these things are real. There are scenarios that play out.
That we've seen.
And that we have seen. That they were referred to a hospital that was not a hospital. And then anybody wants to set up a maternity. It's not a joke. All these things must be present. And the government has to monitor these maternities. Because a lot of things go on there. A lot of things go on there that are terrible. And the only way to stop it is to audit them. What's the qualification? When last did you go for a training? When last were you went for a refresher course?
What was the qualification of the support staff?
Support staff and various things. Not the person who is the cleaner. When the woman is in labor, the cleaner also joins them to assist in delivery. The gateman also can join if there's any problem. All those kind of things.
The man that takes care of the generator
can come and join to assist. No, everything has to be there. Because once a life is damaged that way, it's terrible for the person, it's terrible for the parents.
And a huge loss to the society.
And the society loses majority of the potentials of that child when they come in. So morbidities after delivery are serious matters. So the child has gone home, everybody is happy, then everybody is kissing the child. Everybody is hugging the child. Before you know it, the child falls sick. He's gotten some infection from the people who
met in immediate
so, and those kind of things can lead to another set of problems for the child.
Wow. Another very interesting episode of Health Plus. We've had with us Pastor Dr. Olushola Okoonla, a consultant pediatric neurologist, and we've been discussing preventing infant post-delivery morbidity.